Hi, I'm Dr. Paul Nassif. I'm a facial plastic surgeon. And what I'd like to discuss with you today is what are the risks with rhinoplasty surgery, especially revision rhinoplasty surgery. Many patients will come in think that it's a very easy procedure and they can go out about their way and go back to work immediately and look great in 1 week. Unfortunately, it's not true. Rhinoplasty surgery is the hardest surgery that we perform. It's something that takes a lot of expertise to perform rhinoplasty surgery, and my goal is to tell you some of the possible risks and complications associated with surgery. Now, obviously, I don't expect many of these things to occur, but I want to tell you what can occur so at least you are aware and informed. From bleeding, infection, maybe not getting the exact result that you want, to scar formation inside your nose where you can build up scar tissue, especially in this region, to possibly, if you have an open rhinoplasty, having the little scar not heal right. That's rare, but it can happen. These are a few of the things that we want to initially mention in rhinoplasty surgery. If we're performing a septoplasty, there's something that can occur. It's called the septal perforation. A septal perforation is a little hole that's made inside the nasal septum. You can't see it from the outside, but from the inside it can cause nasal obstruction, it can whistle when you breathe in, and cause crusting or a little bleeding around the nose. Usually if this is going to occur, there's a little slight higher chance in revision rhinoplasty when the patient's already had a previous septoplasty or in a situation where there's been previous trauma to the septum. But usually I can see that there may be a risk of a perforation there, and I'll usually do something at the time of surgery to correct it. So again, these are really rare risks, but I still want to explain them to you. Sometimes when we lift up the skin of the nose, you can get little broken blood vessels called telangiectasias on the nose. That's just by elevating the tissue. If that occurs, we can treat that with a laser called a pulse dye laser. And that's something that can be corrected after surgery. I could overdo your nose or underdo your nose. It's rare, but this can happen. I mean, it's a risk when we take undergoing surgery. Sometimes if there's a little hump left behind, or if I feel that the profile is straight, but then as time goes on, the little area here called the cartilaginous hump can sometimes depress a little bit. So you'll see like a little hump, and then it goes in a little bit right here. That can happen 1 or 2% of the time. Sometimes you can get something called a callus or a little scab along the nose right through here. Now with the scab, this could occur 1 month, 6 months, 9 months later on. And if that happens, we usually can remove that little callus or little bump with a small incision inside your nose. It usually takes about 20 minutes, and we do it in the operating room. Prolonged or chronic swelling or edema, especially in patients with thick skin. The nose can swell up after surgery and can stay swollen up to a good year. Asymmetries, irregularities. This is something that will happen with the nose. No matter how perfect the nose looks in surgery, with the healing of the nose, you will have some asymmetry or irregularities. So your nose will not be perfect. And the reason why this occurs is because of three-dimensional healing of the nose and shrink wrappage. With shrink wrappage of the skin of the nose, especially if it's been previously operated on, this will occur. So sometimes we might not get the absolute desired outcome that we want because of this reason. Sometimes the nose will look great for the first 3 months, and then following 6 months, a year, even 5 years down the line, the nose will keep changing. Sometimes these asymmetries can develop and be seen later on as the nose heals. But at the same point, 1 year, 3 years, 5 years, the nose may even get smaller and look better with time. So either there can be asymmetries and irregularities versus the nose can look better because the swelling goes down. So if you look at the nose over a period of time, it keeps changing every year. Nasal obstruction. I can make your breathing worse, and that's very, very rare, but there's a chance with doing an aggressive rhinoplasty or even a conservative rhinoplasty, you can get a little pinching of the nose. And with a pinching of the nose, like right through here, it could obstruct your breathing. So there's a small possibility that I can make your breathing worse. I doubt it, but again, I want to mention this to you. What is the chance of you needing a revision surgery following my rhinoplasty with you? Well, the national average is about 10 to 12%. If I look at all my numbers, that's about 2 or 3% of the time I'll have to do a touch-up. Usually if there's a problem in surgery, which is rare, I'm usually able to fix those issues in surgery. So most of the time it's from a healing problem. But no matter what, I have to take that responsibility and we'll have to go back and fix your nose. One of the biggest things with the rhinoplasty is the swelling. Patients will come in and say, when's the swelling going to go down? And what I'll tell patients is that they have to wait at least a good year. And even then, as I mentioned a few minutes ago, you'll still be healing every year. But you need a full year to heal after surgery. After 3 months of healing, you'll have about 60 to 70% healed. But it takes time to heal. So you have to be very, very patient. One of the most important aspects of rhinoplasty surgery is realistic expectations. The patients have to be realistic about their outcomes. And I have to make sure I communicate to you of what you can expect. Especially with the computer morphing, it's not a guarantee of surgery, but I'll make sure I do the best I can. The nose, since it does heal not predictable sometimes, there's really no guarantee. I cannot guarantee you a perfect nose. Your nose, as a matter of fact, will not be perfect. My goal is to give you a natural, improved, better looking nose that you can breathe out of, so it's functional. So patients following a rhinoplasty usually will be very bruised and they'll be very swollen after the first week. You're going to have a cast on and some little stitches and some splints inside your nose. They will all come out at 1 week most of the time. The second week you're going to have tape on your nose. Sometimes after that second week we're going to have you tape your nose for a period of time, every night, possibly up to 2-3 months. Sometimes a little as 6 months. Sometimes I'll give you nasal exercises to do where you're taking your fingers and pushing on your nose very gently through here. Sometimes we'll just have to wait till some of the irregularities just resolve. And following surgery, you can't expect perfection. The nose will keep changing every few weeks. Following surgery, you're going to have numerous medications to take that you have to make sure you follow the instructions and take all the medications. There's treatments such as hyperbaric oxygen, which is 100% compressed oxygen, which may help you heal faster. There's products called platelet gel, which we can use in surgery to help you heal faster. It's a product from your own blood that delivers growth factors and healing factors that help you heal faster. There's arnica cream, there's pineapple extracts. There's all kinds of things you can do after to help you heal faster. But the most important thing is following our instructions that we'll give you. In general, there's not a lot of pain with surgery. Most patients will take Tylenol, but we will give the patient pain medication prescription for after surgery if it's needed. You do want to make sure that you don't want to take too much pain medication because it can also make you constipated. Sometimes we'll tell you to take Colace, which is an over-the-counter stool softener to help keep things working without you getting constipated. When it comes to revision rhinoplasty, it's very difficult and it will take a lot longer to heal. And one of the reasons why I take a long time in surgery, sometimes 4 hours for a rhinoplasty, longer for revisions, depending on what we're doing, because I'm adding structural grafts in the nose to prevent it from collapsing. And the reason why this happened is because I do so many revision rhinoplasties and I read so many operative reports that are very conservative. I see these noses that come in after a couple of years from surgery and I see them collapsed. So I'm going to add certain grafting material in certain situations in the nose, whether it's a columella strut right here inside your nose to keep it from falling down, or spreader grafts which are put right inside here to prevent the nose from collapsing in, or other types of cartilage called lateral curl strut grafts or rim grafts to prevent the tip from collapsing in. And I won't do this with every patient, but in many patients I will. I want to make sure that I give you the best job as possible since I'm very detailed oriented. I'll even take my camera inside the room and I'll look at your nose since it gives me the better details of the nose. Sometimes I'll perform a closed rhinoplasty, which is maybe about 15% of my practice, and that's making incisions inside the nose. Usually you have a little bit less swelling with that as compared to the open rhinoplasty, but your visibility is less. So if I'm performing a lot of tip work, I'll usually go to the open rhinoplasty. So this overall is a good summary of what's involved in rhinoplasty surgery. It's time consuming, it takes a long time to heal. You have to make sure you're going to follow my instructions if you undertake this operation and decide to do a rhinoplasty. But my goal is to communicate with you and make sure I give you the best job possible. Thank you.